My big question for you is how should we be living together as citizens in an aging society?
An aging society is one in which more people are over the age of 65 than are under the age of 15. So the average age of people in an aging society is going up. Now, aging societies include the United States, Canada, many countries in Western Europe, many countries in East Asia, countries like Australia, New Zealand. So, wealthy, technologically advanced societies, by definition, are going to be aging societies. And the reason there's two trends that come together that create an aging society. One is population longevity, people living longer lives. The other is lower birth rates, smaller families. So when we think about, say, the past century, when we have public health innovations like clean water, sanitation, better designed houses so that the disease isn't spreading as much. When we have vaccinations, we cut child mortality, we cut deaths in childbirth. We have people living longer. They're surviving their childhood. They're surviving early adulthood. And then when you hit midlife and you see age-associated conditions coming in. You see the development of interventions, drugs, technologies that prevent or cure or slow down age-associated illnesses, heart disease and lung disease and cancer and so on and on. And so you wind up with people who are living longer lives. Their ancestors might not have lived as long, even if they'd survived early life. At the same time, you have more reproductive choices for women. You have women able to decide how many children they're going to have, when they're going to have children, and you have more economic opportunities for women. So when you see that people don't have to have lots of children in order to survive, in order for just some of them to reach adulthood, that is when you've set up the conditions for an aging society. You could almost say it's a kind of achievement. It's a kind of public health achievement, but we tend to think of it as a problem.
So, Nancy, considering we all want to live forever, or maybe we
But
don't,
do we?
maybe we don't, we'll get to that. Um, it sounds like a great achievement that people live longer. It also sounds like a great achievement that women can decide how many children to have and families are smaller because of choices. So, what are the issues associated with an aging society? Is that a problem? Is that a great thing? What does your research tell you?
Well, when we look at aging societies like the United States and also many other societies in North America, Western Europe, Asia, we see that there are consequences to people living longer lives. The fastest growing cohort is often people over 85. But with a smaller group of people who you will presume will be caregivers because they're family members. So smaller families, longer lives, older people, you begin to have gaps in the idea of caregiving, of responsibility for the next generation. So this is a real challenge in aging societies. And I should add that aging is a worldwide trend. It's associated with wealthy societies, but it is the IMF has said it's the major global trend of the 21st century is going to affect every society.
So, which countries in the world are showing this trend the sharpest? Is Japan sort of at the head of some of the?
South Korea and Japan, absolutely. When you have again, you have long lives, small families, and also not as much of a history of immigration. So immigrants tend to be young, in any part of the world, and they often go into care work. So you are now beginning to see in some East Asian countries people coming in, whether as guest workers or as immigrants, specifically to do care work.
Do you think this trend is an opportunity? Is it a problem? How would you characterize the trend?
That's a great question. I tend to think of it as it's a phenomenon. It is a social phenomenon, it's a demographic phenomenon, it's part of our reality. I don't think it's helpful to get into the habit of only thinking of it as a problem, because what happens in those cases is we tend to blame older people for the problem. We tend to say, "Oh, people have lived too long," or they can't afford things, well, they didn't plan. Well, we can't say to people there's a time machine and you can go back and have rich relatives, so that you have lots of money now to take care of yourself. We have to recognize that there one of the consequences of a century of better public health, of investments in basic things like clean water, so that you don't have cholera outbreaks, is the fact that people began to live longer and longer and healthier lives. And so what that means, if I go to, I recently had a physical, and when I went to my PCP, my primary care provider, he said, "You're a healthy young woman." I like, huh, young, but he said, "You're going to live to be 100." And it's like, really? But he knows my mother's 90. So it's like, it's very reasonable if you have gotten to midlife in a certain stage of health to imagine that it's not going to be remarkable. In my childhood, it was remarkable when somebody lived to be 100, but it's not so remarkable anymore. So what I find so fascinating is that late life, this longer period of life could last 25 to 30 years as a social experience, as a human experience. We've had a habit of compressing it to illness and the end of life. But we need to do our thinking about this stage of life, just as we do thinking about other developmental stages of life.
So, Nancy, you mentioned the economic aspect of this. Did we save enough? Did we plan? Are we going to be poor later in life? Which is a very scary thought. It's like the worst time in life to be poor.
Exactly.
But I'm also thinking, considering I've lived and worked in several countries, about the cultural aspects. When I talk to some American friends, they take care of the parents, but they don't feel like they really must. It's a choice, it's the ethical thing to do, but it's not perceived socially as absolutely your responsibility. It's almost like you do it if you're nice to your parents. And my friends in Asian societies absolutely perceive it as a fundamental obligation. So, how do you think about those cultural differences?
Well, I've done quite a bit of research in Singapore, and also some work in Hong Kong and in other East Asian societies, all of which are aging societies. And I remember once being I was having breakfast in Singapore, and the barista who was serving me asked me why I was in town, and I explained that I was doing a research project, and it had to do with Singapore's aging society. And she said, "Oh, of course, we're an aging society. I know all about that. My grandmother lives with us," and was telling me about how her family worked. And most people in Singapore live in public housing, and there's a strong expectation, as you say, that your parents will live with you and you will look after them. And there is a value, often in Confucian societies, expressed as filial piety. The idea that you have, as a good daughter or a good son, that you will remain loyal to your parents, that you will look after them. And sometimes this is even written into policy. Um, we lack a word for that in the United States. But when you look at the data on this, we are all caring for our parents in this country. The typical caregiver for an older adult in the United States is a family member, usually a woman, often a daughter. And I'm one of those daughters for sure. But we do have this idea that other societies are better at this, or that Western European societies have figured out how to finance everything, that there's this other society that does it right. And I think we give ourselves short shrift or not enough credit for the work we're actually doing. There's been research that shows that American caregivers of older adults have difficulty identifying themselves as caregivers. They imagine, well, you have to be doing everything to count as a caregiver. I always think that's interesting because a parent wouldn't have any difficulty identifying as a parent. They can see the children are right there. They're holding the baby. But it's a more gradual process with caring for an older adult. You take over the driving, or you take over the errands, the doctor visits, and you're doing more and more things. You're doing the taxes or managing the finances, and suddenly you're doing what a person used to do for themselves, and or maybe what two people used to do for themselves. but it's a lot, but we don't always have a language to talk about this.
So you and I often chat over coffee about the caregiving that we're doing with our parents. What is the impact at a systemic level, at a social level? You know how you live the care of your mother. I know how I cope with my father's declining health. We talk about it individually. But what does that mean for society when people who have full-time jobs plus
Right.
all of a sudden have an extra job?
Well, it is a tremendous balancing act. It can feel like a burden. There has been some really good research on this from organizations like TIAA-CREF, which is a major pension fund in the United States. So here they are uh, helping people plan their retirements, but they're now saying, you know, what we really need to do in an aging society is help people grapple with longevity, help people grapple with caregiving. The fact that this isn't just about, you know, a sailboat and travel and leisure, but the fact that you may be 70 and caring for a 95-year-old. You need to be thinking about yourself at 95. It is helping people take the very long view and, yes, figuring out how their money will work. Because in the United States, and this is a big difference between the United States and the other aging societies I've mentioned, is we tend to be responsible for the cost of a lot of our own care. That's usually the biggest shock that an older adult or a caregiver has when something big happens and you realize that Medicare, the universal insurer of people age 65 and older in this country, does not cover many forms of care. And people are just completely surprised by that. Was not what they thought, and they are then scrambling. So we really grappling with that is very challenging. What we shouldn't do is blame individual people for failing to be rich. One of the best pieces of advice that I ever heard for a family caregiver was not this idea of self-care, like you have to look after yourself. Well, you're looking after somebody else. How can you look after yourself? Was talk with another caregiver. So finding community, I know this from personal experience, finding community with other people, usually women, usually in midlife, working full time, often with teenagers or paying college tuitions, who are grappling with these responsibilities that change every day on behalf of their mother or their father, or sometimes both. You really need those reality checks. You need those little cups of coffee, having lunch together, just blowing off steam in a way, but also sharing resources. You know, one of my neighbors, who's a physician, her mother and my mother live in the same county in a different state. So we can swap resources. If you try, oh, you've got that problem, you've tried this phone number, or this nurse practitioner is really great on these issues. So that I think is so important. It's much you can't really like uh, you know, what take a seminar on this or read a, you know, long-term care for dummies or something like that. It's much more immersive and gradual at, you know, how you learn how to do this. But beyond that,
But on that point,
yeah,
Nancy, we all say it takes a village to raise a child. It's almost like it takes a village to raise a parent.
yes, exactly. One of the things I've learned in the Hastings Center about 10 years ago launched a research portfolio called Bioethics for Aging Societies. And that for is really important. How can our work be for people in an aging society? And it grew out of our work on end of life care and other aspects of healthcare. But in part, I realized from my parents' own experiences at the time, my father had Lewy body dementia. My mother was caring for him. I knew that there was a lot more that was going on beyond medical decision making. That was important, but it wasn't the whole story. And so we convened a very large group of experts who were all in gerontology in some way, the study of aging. Um, Architects, designers, economists, social scientists, all kinds of people who were each thinking about one aspect or another of this problem. And one thing that they kept coming back to was the importance of community institutions, of walkability. It's very important in Boston. There's a whole network of how to make Boston more walkable because you've got those very old sidewalks. Um, uh, Housing, community planning, hugely important because as people age, they spend more time in or near their home. So I've done a lot of work over the years with my colleagues at the Harvard Joint Center for Housing Studies because they have a project called Housing and Aging Society. So it goes very well with bioethics for an aging society. They have the data and we have the analysis, and we think of ways to help people have conversations about this aspect of their community. One of my questions is always when you think about a place as a good place to live, is it a good place to age? Is it a good place for people of all ages? That's very exciting.
When I asked earlier, what can we be doing to live together in an aging society? Some of what you just said suggests that it's so structural. I mean, it's about urban planning or just sidewalks and what's being done or what can be done to move that forward in a positive direction.
Well, one of the things that's crucially important is involving older adults and also caregivers because you often these people are together in different situations, what their real needs are. Don't assume, ask, invite them in, co-design. So, one of the most exciting projects I can think of went on in several European countries where they asked people living with dementia, because most people with dementia live in the community, not in a nursing home. 70% of people live in the community. They asked people with dementia to say, "Show me your neighborhood." And people were pointing out where it was safe to cross the street, where it wasn't safe to cross the street, where the bus route was, where all the shops were, where if you needed help, he knew you could go in because these were friendly people. And what they did in some of these communities was they then took all this data and they turned it over to community planning. And they said, now we know where the traffic lights should go, where the curb cuts should go. This is important data that shows how some of the most vulnerable people in a community, who may be some of the longest living residents of a community, use it, you know? Um, I think the idea of the third place, that idea of that cafe or the gym or the other place that isn't your home or isn't your office really matters to older people as well. Maybe the office isn't there anymore, but they certainly want a place that isn't the home or a doctor's waiting room. You want a destination. It usually has to be a walkable destination. When people are less and less mobile, they need things to come to them, but people remain social, they remain interested in creativity, and their place matters to them.
Nancy, you talked about planning, the importance of planning. And I was thinking about myself at the very personal level. My husband and I are in our 50s. We just bought a house and we have very different personalities. For him, it was important to think about, will this house still be appropriate for us in 20 and 30 years? Is there a bedroom in the main floor? Can you use the house if you're not able to go up the stairs? And I was in denial about that. My approach was, I will always be able to go up the stairs. I don't even want to face that possibility. What should we be thinking about in our 30s, 40s, 50s in order to age better later? Considering it's natural to be a little bit in denial about the limitations that await us.
Right. Great question. Your husband is thinking along. Well, for one thing, he's picturing that you're going to stay in this house, which is interesting. And a lot of people do when you're in midlife. You've made that big investment. For most Americans, their largest single asset is their home, is the home that they've purchased, and so. Our ideas about our home, there's a lot of associations. We've raised our children in them, we've furnished them, and so on and on. And moving, nobody likes to move. So by that point, you're thinking, well, I'm going to just stay here forever. I'm going to age in place. And that's great for a while. It doesn't always work forever. It can be a wonderful thing, but at a certain point, stairs become a barrier just because of what a scientist would call cellular senescence. The body starts wearing down. The cells they don't regenerate as well. It's not an illness. It's just what happens to the body over time. So if you were talking to a geroscientist, someone who studies aging at the cellular level, they would say, well, our goal is to increase your health span to make it match your lifespan, but we're not there yet. So we need to accommodate our aging bodies. Um, Removing stairs is really helpful. Most people have to stop driving at a certain point for reflexes, eyesight, and so on. So the idea of having living all on one floor, redoing your bathroom, your counter height, and so on, is all really important. But you may find that no matter what your husband is imagining, that's house where you're raising your family now is just doesn't work for you. Let's say you're 80 or 85. You're thinking, I would like something a little bit different. Well, what we need to do, and this is something I'm very passionate about, is give typical Americans more choices in their housing. They shouldn't have to make a house work for them if it doesn't work for them anymore. And so what we need to do is when we're thinking about our crisis of affordability and housing, we have to remember it applies to older people as well. Older people are on fixed incomes. They need accessible housing, so it has to be designed so that it is safe and easy to navigate. And it has to be a good fit, again, for a person who isn't driving. It really helps if things are walkable. So what would be great, in addition to working with the house you have, is also finding out if in your town, are there any plans to build what's often called senior housing or congregate housing? Because that gives people more choices.
Do you think people in middle age or younger need to maybe reframe or rethink how they think about aging? Let me give you an example. So I often like to think that everybody wants to live a long time, but the tax you have to pay, the penalty, the fee for that is biological aging. You're going to really slow down. And it's not like you're going to continue on the way you are now for decades on.
Right.
Is that a bad way to look at aging, or what are your thoughts on that?
It is challenging because many accounts about aging that we read, like, in columns that show you how to be your best self this year, is this idea of what's sometimes called 50 forever. You're just going to maintain. You're going to reach your peak fitness and you're going to just maintain. And again, maybe that's true. Maybe for some people, 70 is the new 50. But 85 probably isn't the new 50 anytime soon. Um, yeah, that's the rub. As my mother would say, after 85, things start to change quickly. Things can happen one fall because your balance is different. And your bones are thinning. Could be a broken hip, a trip to rehab, and so on. Changes in your life are really accumulate. And the other thing, in addition to all of the physiological changes, are the social changes. People become widowed, their lifelong friends die, their social ties are, just become quite different. And so I, I, I think what we have to do is not solve this by saying, well, I should just want to be really healthy and then somehow die. Somehow, like, you know, close it all out by a certain magical age. Because people usually wouldn't do that. They reach that age, they reach 75 or 80, and then, oh, it's not so bad. You want to keep living. You want to keep living. You're interested in life. But we need to accommodate what is actually going on. We need to not take refuge in a fantasy that I'm just going to buy some land and my best friends and I are all going to live together. And I'm like, what, with a robot who's going to look after you? I mean, who's taking care of all these old people? But we have to figure out how we can live in community, live close to other people. Both not just not for people to help us and run errands, but because it's part of life. It's part of part of our humanity is to be engaged with other people, but we don't want to be afraid of it.
Well, like Vardit said, I mean, I'm also taking care of aging parents. Very lucky to still have them around, but they're high 80s, mid 80s. And I look at their experience now and I think, what can I do to sort of prepare so that my quality of life at that age is as high as it can be? So I'm trying to rethink things like, well, I have hobbies. Maybe I should start getting into hobbies that I can do easily into old age. Like maybe I should go back to playing guitar. Maybe I can do that. My current hobbies right now involve like people trying to punch me in the face. So maybe I don't want to keep doing that when I'm 85. But is that kind of a reasonable goal to sort of like readjust a little bit, like adapt kind of what you're interested in and just prepare for a different body at that time?
I think that's a wise approach. Is find things that you're interested in. It is definitely physical activity is very, very important. You want to keep building bone mass and staying balance, flexibility, all super important. And you'll adjust that over time. Maybe let things that aren't as high impact. um, but thinking about things that will sustain you, the over that will sustain your interest. That's one thing you're always told about people who are experts in retirement is don't just imagine you're going to clock out that last day and you're going to know what to do because work has organized so much of your time and your thoughts and your interests. But I do think that is important to find out what those interests might be that will could sustain you that that you can do wherever you are or whatever your situation in life is. It could be origami for some people. It could be woodworking for another people. For some, it's reading to children at a library. But there is a way. There is something. There is something. But I think that's a very good idea. It also reminds me of whenever I'm in a city in East Asia, and I get up early in the morning to go running, there are always older adults who've gotten up earlier who are doing Tai Chi.
You actually be that person in the Boston Common.
And they are, even I remember once being in Seoul, and there's this park that is up a mountain, and people were climbing up there. They were doing archery first thing in the morning. It was remarkable. And you're thinking, what am I complaining about?
So that's all at the personal level. How can I loved your framing of how can I prepare so that I can do things with a different body that I can't imagine now. It's so fascinating to think about ourselves in that way. We're embodied and that is going to change. How do I prepare for that? But what about how, as a society, we need to prepare? What should our legislators do? What should we do economically at the collective level so that you're not penalized at your most vulnerable stage of life for being poor or just not having enough?
Exactly. Great question. We often in the United States imagine that we're responsible for ourselves, our own money, our own lives, our own health, that we sometimes call that autonomy or self-determination. But this really doesn't solve for aging. It really, the imagining, again, as we've talked about, that we're going to continue in perfect health, perfect wealth. It's a lonely idea, and it's not a realistic idea. Most people, 80% of older Americans, have difficulty paying for their housing and their care. And it's not because they didn't save or plan, it's because of the costs have increased and they're no longer in the workforce. So we have to remember that people in the United States have been counting on programs like Social Security and Medicare their whole lives. Those were promises that were made many decades back. So we have to make sure, even with fewer people paying into these programs because of declining birth rates, that we take care of those. We don't pull the rug out from under people as they're aging, as they're approaching the end of their working years, or as after retirement. So we have to think about that. We need to allow for the fact that some people will want to work well beyond traditional retirement age. Some people will not be able to do that because of the physically demanding nature of the work that they do. Their body just won't let them do that. So we have to remember that we are a big country. People do all different kinds of work, and we have to kind of ride out to meet those differences. We do have to think, we do have to do much more work in thinking about this problem of who provides care and who pays for care in an aging society, because we don't have as many caregivers as we used to. Smaller families, more women in the workforce, you just don't have somebody available there to meet the needs of an older generation. At the same time, we have so much of our care costs are not covered by health insurance that families often wind up financing care as well as managing and providing care, especially if somebody has dementia. So we need to face these issues. We talk a lot about facing dementia or facing caregiving. We've got a number of recent reports on our website that talk about these issues. One thing I try to do in anything I write, whether it's for the Hastings Center or another publication, is to make sure that I give my reader some little bit of information about these economic realities so we can get used to them. So we just say, okay, I understand that a little bit better, you know, but we should be advocating for this. We can't just rely on family caregivers or older adults to do it for themselves for various reasons. We have to just talk about this as an issue in our society that is not polarizing, that cuts across cultures, all classes, and that connects us to other societies in the world. This is just where we are.
Let me ask you a question about the future. So you said that we're kind of running low on caregivers. Some people have the idea that maybe one day AI and robotics can kind of help fill that gap. Do you think that's a fantasy? Do you think that that's something that you think is reasonable? What are your thoughts?
It is a very popular fantasy for sure. It is, people will say, oh, you know, the robot will take care of me, ha ha ha. But it is something that we're turning to all the time. Robots are in our imagination. You think of Star Trek, or there's always some robot in there that that is coexisting with humans, and so we are certainly thinking about this. But a robot, as yet, an embodied machine, can't actually manage the kinds of gestures and touches that would make it safe for them to care for a person. And we're not really sure how people would feel about being touched by a robot. There are actually projects on this issue, robot touch. Um, on the other hand, there are a lot of fantasies about disembodied AI, that as a monitor, as a friend, that can be combined with voice so that you have someone to chat to. These are chat bots, often with voice. There's research on this is moving along very, very rapidly. We know that patients in the hospital, and again, older adults are a very large population in the hospital, sometimes prefer to get information from a chatbot than from a healthcare worker. For one thing, with a chatbot, you can take as much time as you want. Chatbots tend to be friendly and supportive, and aren't just rushing on to the next thing. But we should be wary about the idea that humans are replaceable in this way. Humans need humans. Need human connection. And we certainly don't want the skills of young doctors and young nurses to say, oh, well, the robot will do that. The AI will do that. You don't have to learn that. So I think, again, this is another area where, rather than presuming that there's a technological solution, we have to talk to the people who are affected by whatever the challenge is, older adults, caregivers, and say, what are the problems that you'd like some solutions with, and figure out together with them, co-design with them, what would be possible solutions. Some of these may involve AI, some of these may involve robots, but we would do our thinking together.
So let me speak on behalf of some of the millennials out there. A lot of them are really worried about the future. Like, they may not have a whole lot in savings, or worried about job security, maybe even AI taking over some of their jobs. Are we headed for a crisis for the millennial generation? Like, is there a cliff that they're heading toward, or will there be other technologies, other ingenuity, other ways of addressing that problem collectively so that they don't fall off a cliff later?
Yeah, I'm very familiar with this. I have a number of friends and nieces and nephews who are in that cohort, and they've got young children, they've got school debt, they're never sure if they're going to ever be able to buy a house. And also are seeing their parents aging, so they really feel worried and caught. Um, and they're trying not to worry about climate change in front of the children too much, and freak the children out. There's a lot going on. And again, I think this gets us back to the idea of community and intergenerational responsibility. I feel a responsibility to my mother, but I also feel a responsibility to the next generation. I don't have children, and I do wonder who's going to be responsible for my care. I can't put it all on my nieces and nephews because they have parents. I So part of it is I'm trying to figure out what my aging will be like for people like me. I know people who study people who age solo for the same reason. Who like, what do you do if you don't have a partner? You're trying to solve a problem that you can foresee in your own life. But I do think for people in their 40s and people in their 50s, um, we owe it to them to not just say, well, Medicare won't be here or Social Security won't be here. We have to make sure they are there, you know, because each stage of life should get their chance. Each each generation in the society should get their chance to flourish. People keep flourishing throughout life. Well-being matters throughout life. I see that with my mother. Creativity matters to her at age 90. Um, Enjoying life matters to her. Life is not easy. Definitely not easy in your 80s or 90s. Many, many challenges. But there are opportunities to continue to become as a person. Um, and so we should never give generations who are coming up a message about doom, that this is, the world will be terrible for you, or the boomers took everything, or something like that. We really do have to create or recreate the communities and the society and the social structure that we want and that we deserve. So it's going to be a process of many years and many decades, but taking the long view is what we need to do.
So many people overhearing this conversation may be assuming that we're talking just about able-bodied people who are going through the life course, but certainly there are plenty of people who have disabilities who are not what we would call able-bodied. Do you have any advice for them, or is there anything that they should be aware of as they're thinking through?
The experiences of people who've lived with disabilities of various kinds are extremely germane to thinking about aging. For example, issues like the design of a home, the design of sidewalks and parks, in terms of accessibility, matter to older people who have diminished mobility now, or maybe using a walker or a wheelchair for the first time, and to a person who's been using these devices for a long time. So there's a lot of opportunity for mutual learning at every level. And in our work in bioethics for aging societies, we continually bring in scholarship from disability communities so that we have the ideas, but also the solutions in the mix. Very, very important point. Thank you.
Nancy, this has been fascinating. I've learned so much, and you forced me to face my not just my mortality, but my pending aging.
You're welcome.
What concluding thoughts can you share with us?
One thing that I would share is when I talk about these issues with young people, with people in high school, and as undergraduates, my goal is usually to get them excited about this. And I think the issue of talking about citizenship, fellow citizenship, being a member of a society gets them excited, gets them thinking, gets them off the idea, oh, you're just talking about old people or my grandmother or something, but gets them seeing themselves in relationship to other people. In my apartment complex, we have a program in the winter where we make and deliver soup to residents of the community. Many of them are older, with home health aides, but some have just had a baby or maybe they've just had surgery. And this year, I recruited my 14-year-old niece to help me because it's a lot of soup to carry. And it was good for her. It was good for her to have a chat with people and to see what people's lives are like and to notice who has an elevator and who has to walk up their stairs. We had some good conversations and she got some community service hours. But I think that is one thing that I find interesting is thinking about each generation, each cohort, and bringing them into this aspect of our society, which we're talking about 100-year span. So lots to think about.
Well, that is so fascinating. I'm really delighted to hear that young people are also getting engaged in this issue. Thank you, Nancy, for joining us today. This is really fascinating.
Thank you.
Thank you.
Thank you.